All right, picking up where we left off, this is part 2 of chapter 5. We were just discussing the brain development, and harming the brain. We're now moving on to perceiving and moving in terms of the senses. Sensory development typically precedes intellectual and motor development. Sensation is a response of a sensory system. Think in terms of the eyes, ears, skin, tongue, and nose when it detects a stimulus. And perception is a mental processing of sensory information when the brain interprets a sensation. A person could hear but not understand, like a baby, or can understand but not speak if Broca's area is damaged. Hearing occurs in the temporal lobe in both hemispheres, shown here in the green and some of the red parts of the brain. Language comprehension, however, occurs mostly in the left hemisphere, shown here in the brown region that responds to known words, and Broca's area, the red bulb that produces speech. All right, perception follows sensation. Infants' brains are especially attuned to their own repeated social experiences, and perception occurs. The infant brain and auditory capacity to hear sounds in the usual speech range occur, and the parts of the cortex dedicated to the senses develop rapidly. All right, to specifically talk about hearing, it develops during the last trimester of pregnancy. It is the most advanced of the newborn senses, and speech perception occurs by 4 months after birth. About one baby in 100 cannot hear normally. Normal newborns can hear quite well. All right, moving on to sight. This is the least mature sense at birth. Newborns can focus between 4 and 30 inches away. Experience and maturation of the visual cortex improve shape recognition, visual scanning, and details. Binocular vision occurs at 3 months. In many ways, the vision of the new infant is attracted to the eyes of other people, and by age 1, infants interpret emotions, follow gaze, and use their own eyes to communicate. Binocular vision is the ability to focus two eyes in a coordinated manner in order to see one image. All right, moving on to smell and taste. They function at birth. They rapidly adapt to the social world, and they are related to family and cultural preferences, and may have evolutionary function. Learning about a lime. As with every other normal infant, Jacqueline's curiosity leads to taste and then to a slow reaction, from puzzlement to tongue-out disgust. Jacqueline's responses demonstrate that the senses of taste are acute in the infancy and that quick brain perceptions are still to come. And moving on to touch, the sense of touch is acute in infants. Although all newborns respond to being securely held, soon they prefer specific touches. All right, talk about pain now because that is a response to touch. Pain and temperature are often connected to touch. Some people assume that even the fetus can feel pain. Others say that the senses of pain do not mature until months or years later. Many NICU have adopted pain and stress reducing practices. This baby will cry, but most experts believe the heel prick shown here in the picture is well worth it. The drops of blood will reveal the presence of several genetic diseases, including sickle cell disease and cystic fibrosis. Early diagnosis allows early treatment, and the cries subside quickly with a drop of sugar water or a suck of breast milk. All right, moving on to motor skills. Motor skills are learned abilities to move some part of the body in actions ranging from a large leap to a flicker of the eyelid. First movements are not skills but reflexes, involuntary responses to a particular stimulus. Caregiving and culture matter. Reflexes become skills if they are practiced and encouraged. Okay, and gross motor skills are physical abilities involving large body movements such as walking or jumping. In terms of course of development, the cephalocaudal head down and proximodistal center out direction. The baby learns to control the head first, then the body center, and then extremities. Sitting, standing, crawling, walking backward, running, and jumping are all included. There are dynamic systems underlying motor skills. There are three interacting elements underlying this. The first is muscle strength. Newborns with skinny legs and 3-month-olds buoyed by water make stepping movements, but 6-month-olds on dry land do not. Their legs are too chubby for their underdeveloped muscles. Another element is brain maturation. The first leg movements, kicking, alternating legs at birth, and then both legs together, or one leg repeatedly at about 3 months, occur without much thought. As the brain matures, deliberate leg action becomes possible. And the last of the three underlying elements is practice. Unbalanced, wide-legged, short strides become a steady, smooth gait over time. Most important experiences are perceived with interacting senses and dynamic systems. Sensations facilitate social interaction and comfort. By 6 months, infants are able to coordinate the senses. All right, we talked about gross motor skills. Now we'll discuss fine motor skills. These are physical abilities involving small body movements, especially of the hands and fingers, such as drawing and picking up a coin. It is shaped by culture and opportunity. Again, caregiving and culture matters. Reflexes become skills if they are practiced and encouraged. Sensations and motor skills further three goals. That is social interaction, comfort, and learning. Most important experiences are perceived with interacting senses and skills in dynamic systems. Success. At 6 months, this baby is finally able to grab her toes. From a developmental perspective, this achievement is as significant as walking, as it requires coordination of feet and fingers. Note her expression of determination and concentration. Cultural variations. All healthy infants develop skills in the same sequence, but the age of acquisition can vary. Variations have influences by genes, cultural patterns, nutrition, which is malnourishment, it can lead to slower development, and caregiving patterns, which can promote or hold back certain things. Specifically, all babies learn to walk, but in some cultures that can be sooner or later. Some cultures have threats like snakes and don't teach their children to walk until a later age. This prevents them from wandering off and being threatened by nearby wildlife. Remember, difference is not a deficit, and slow development relative to local norms can indicate a problem that needs attention. Surviving in good health. Most child deaths occur in the first month. In developing nations, 99.9% of 1-month-olds live to adulthood. Educated women have fewer but healthier children. Scientists at work, SIDS, or sudden infant death syndrome. In research with young children, a scientist found that almost all SIDS babies she studied were sleeping on their stomachs. Stomach sleeping now is a proven, replicated risk. Other risks include low birth weight, being male, parents that smoke, soft blankets and pillows, bed sharing, winter, and a variety of abnormalities. Most SIDS victims experience several risks. As more parents learn that a baby should be on his or her back to sleep, the SIDS rate continues to decrease. Other factors are also responsible for the decline. Fewer parents smoke cigarettes in their babies' rooms. That might be a hard one to conceive for this generation, but when I was younger, smoking was in rooms with everyone and no one thought of it or spoke of it. Immunization seems especially relevant now given the pandemic. All right, this primes the body's immune system to resist a particular disease, such as a vaccination. It contributes to reduced mortality and population growth and herd immunity, which is a term you may have heard thrown around lately. This is when I think over 80% of a population has the antibodies for that particular disease, and then is a term called herd immunity at that point. Past successes for vaccinations include smallpox, polio, and measles. Immunizations can, however, be unsafe for embryos exposed to rubella, for newborns, and people with compromised immune systems. Problems can include no effective vaccine found for certain things such as AIDS, malaria, cholera, typhoid, and shigellosis. Many rural areas of the world are not reached. There are reactions to a vaccination and potential side effects. Adequate nutrition is necessary for a child to develop normally. For every infant disease, including SIDS, breastfeeding reduces risk and malnutrition increases it, stunting growth of the body and the brain. Breastfed babies are less likely to develop allergies, asthma, obesity, and heart disease. As the infant gets older, the composition of breast milk adjusts to the baby's changing nutritional needs. All right, I've mentioned malnutrition a couple times now. There are different forms of it. One is protein-calorie malnutrition. This is a condition in which a person does not consume sufficient food of any kind that can result in several illnesses, severe weight loss, and even death. There's stunting. This is the failure of children to grow to a normal height for their age due to severe and chronic malnutrition. And there is wasting. This is a tendency for children to be severely underweight for their age as a result of malnutrition. Improvement is seen in East Asia, Latin America, and Central Europe. And an increase in Africa, high birth weight, maternal AIDS deaths, and climate changes and civil wars there have been causes. Effects of chronic malnutrition. Learning suffers. Brains may not develop normally. If malnutrition has continued long enough to affect height, it may also have affected the brain. Diseases can be more serious. Malnourished children have no body reserves to protect them from common diseases. About half of all childhood deaths occur because malnutrition makes a childhood disease lethal. Some diseases result directly from malnutrition. Both marasmus during the first year, when body tissue wastes away, and kwashiorkor after age 1, when growth slows down, hair becomes thin, skin becomes splotchy, and the face, legs, and abdomen swell with fluid, called edema. And that is it for Chapter 5. Thanks for listening.